We spend about 1/3 of our lives asleep, and the quality of that sleep can greatly affect our quality of life. At least 80 million Americans suffer from chronic sleep disorders, and studies show another 20 million struggle with occasional sleeping problems. Problem snoring is a common sleep disorder that can affect people of any age. Snoring prevents the snorer and his or her sleep partner from getting a good night's sleep. Snoring is caused by a narrowing of the upper airway during sleep. If you have large tonsils, a long uvula, the small piece of soft tissue that can be seen dangling down from the soft palate over the back of the tongue, or excess flabby tissue in the throat, you are more likely to snore. All of these areas relax during sleep. Other lifestyle factors like weight, alcohol consumption, and the use of tobacco or medications can also increase the likelihood of snoring. But the most common cause of snoring is a tongue muscle that becomes too relaxed during sleep. When relaxed, the tongue gets sucked back into the throat and obstructs the airway, as shown in this MRI image. When air is forced to travel rapidly through the narrowed airway, it causes relaxed soft tissues of the throat to vibrate. It is this vibration that creates the sound of snoring. If sleepless nights due to snoring have become a common occurrence, take comfort in knowing there is a simple, affordable treatment, and it's available here at your doctor's office. It's called the AveoTSD, and it's considered a revolutionary treatment for snoring. The AveoTSD is different from other anti-snoring devices because it attaches to the tongue instead of resting on your teeth. It stays on through gentle negative suction, ensuring the tongue is held forward during sleep. The AveoTSD increases airway space by preventing the tongue from falling back in the throat, reducing air velocity and soft tissue vibrations, thereby reducing snoring. Unlike other anti-snoring devices, the AveoTSD is indicated for virtually anyone and does not require any impressions or molds of your mouth. The AveoTSD is even indicated for patients with TMJ or who wear dentures and are completely edentulous. It is truly the most conservative and versatile appliance currently available for the prevention and treatment of habitual snoring.
Well, it was brought to my attention that I snore quite a bit, and I have the bruises to prove it. Wasn't sure what to do, so I told my dentist about it, and she recommended that I try a device that moves the jaw forward, and it helps bring the tongue forward, which opens the airway. The challenge with that device, while very comfortable to wear initially, is when I woke up, I had some discomfort in the TMJ area, and so it helped me sleep better, but then I had a negative side effect from having some pain. So the next step was to try this new device, which I had heard about, which is looks like a binky. And so you basically attach it to your tongue with light suction. It moves the tongue forward and does the same thing without involving teeth or any connections. So I tried that, and right from the get-go, it's very comfortable. It was easy to get used to. The first couple nights I did lose it, so it was a matter of playing around with the amount of pressure to apply to get it to stay in place. But after a couple nights, I've been able to maintain it throughout, and amazingly enough, I sleep through the night and no complaints about snoring. And the other benefit is that I certainly wake up more refreshed with a lot more energy. So it's a great product, and I'm very happy to have discovered it.
As Robin explained, snoring is debilitating to daily life. People who suffer from snoring take in less oxygen and, as a result, may complain of gasping, irregular breathing during sleep, chronic fatigue, or falling asleep at inappropriate times. The problems created by snoring don't stop there. Morning headaches, forgetfulness, poor mental performance, nighttime reflux, GERD, or morning heartburn can occur. It is now recognized that snoring can be a sign of bad health. Snoring is linked to high blood pressure, stroke, cardiovascular disorders, dementia, obesity, diabetes, depression, and even heart failure. For these reasons, it is important to speak to your doctor about problem snoring. An underlying health condition may come to light. Best of all, the treatment can begin immediately, and results can be seen in as few as 7 days. Save yourself from another sleepless night by talking to your doctor about the AveoTSD today, and your long-awaited solution for snoring can begin working tonight.